Good evening, everyone. Welcome to another Salty Dog webinar. I'm Alex Helfand, Education Coordinator. And tonight, we're really happy to have the second in our five-part series on emergency medicine at sea, presented by Alex Cullen, who's the Director of GW Maritime Medical Access. And tonight's topic is burns and skin ailments. We started to touch on it a little bit the last time we talked, when we were talking about sea lice, and Alex will talk more about that and other things tonight. So with that, I will turn it over to Alex. Please put your questions into the chat, and we will get to all of them at the end.
Perfect. Thanks, Alex.
Great, thanks. Yeah.
So good evening, everybody. I hope you're all doing well. I'm coming to you live from Washington, D.C., where it's like 65 degrees out and we can't decide what's going to happen next. My name's Alex, as Alex so kindly introduced me. I'm the director of GW's Maritime Medical Access and, a cruiser at heart, but a paramedic and flight paramedic by trade. And we'll be talking today about burns and sort of skin issues that can be encountered anywhere, but sort of narrowed down to the focus of while at sea. We'll talk a little bit about the management considerations for these things in general, and then at the end have sort of questions about specific pieces. So thanks for having me, and let's get rolling. So when we talk about these medical lectures here, the point of this is to get people thinking and to get people thinking before they get on the boat, but also to get, a dialogue going, because I think that we can all really learn from each other's experiences here. One of the things that I think is really great and unique about the Salty Dogs is that you guys have this communal wealth of knowledge, and sort of sharing your experiences back and forth can help people be the most prepared for the adventures that you're undertaking. This is the second in our five-part series. My understanding is that the lectures are being recorded and they're available online. So if you need to go back and check something out afterwards, in this presentation specifically, there's some nerdy stuff about electricity and how the body reacts to it. And I'm not going to breeze over those slides because I want to skip it, but in our short course tonight, we've got to cover a good amount of stuff. So there's a couple slides in there for you to go back and enjoy or read for reference at a later date, and I'll point those out when we get there. Our next chat's going to be on March 25th, so 3 weeks from today, and that's going to cover sort of musculoskeletal injuries. Today we're going to talk just about skin and burns. So why do we talk about these things? I think it's worth understanding that the service that I work for here at GW takes calls from seafarers across the globe. 10% of the calls that we get on any given year are related to skin issues. That 10%, about 30% of those are bacterial infection. And so the reason that I bring that up is that a bacterial infection is really manageable. And even more than manageable, it's really diagnosable with a photo. And so in your world of cruising, this is like one of those things where having antibiotics on board the boat and someone you can text a picture to and say, what antibiotic should I take for this, can keep you out on the water having fun. And again, the hope here with all of this is that you guys get to have more time cruising out, seeing the beautiful sights in the water, and less time trying to figure out if there's a clinic that you should go to. The chart on the left is just a breakdown of that 10% of calls. And again, you'll see at the top things like cellulitis, cutaneous abscess, all of those things we're going to talk about. There's a couple weird, words on here, and I'm happy to go through them at the end. But we're going to actually start off talking about burns. I think we all too often consider that we need safety precautions for being in the water. We consider that we need safety precautions for getting back onto the boat, for tracking our location. But I find a lot of boats poorly equipped for dealing with fire. And I say that because most people have never used a fire extinguisher, and most folks don't have a fire blanket on board, and there's a number of different things that can start fires on a boat. So I do think that a part of every galley needs to be a fire blanket, because fire extinguishers can actually spread some types of fires, especially if you're too close or in a closed environment. So again, appropriate fire extinguishers, super important. And a fire blanket, I think, are like two really, really fantastic things. Fun facts about fire blankets, they're like $20 to $25, and they're reusable. You can put out as many fires with a fire blanket as you want to. And so, again, I think that this is a piece of kit that makes a lot of sense in all boats, and houses for that matter. But I think, on a big piece of plastic, it's even more important. So we're going to talk about burns and how they work. And I'm not going to talk a lot about frostbite, but what I want everybody to sort of keep in mind is that frostbite is a cold burn. And we think of burns as hot, but in reality, the damage to your skin is identical in both directions. So, when we talk about first degree, second degree, third degree burns, frostbite comes in the same exact categorization, and it's by depth. So what is there out there that can burn us, right? Well, we've got the sun. That's probably the biggest problem because it's on frequently. And as much as we try and put shade on a sailboat, it seems like there's never enough of it. A lot of us have fuels on board, and those fuels are great. They're super energy dense. It allows us to carry, a couple 100 miles of range in a small 100-gallon tank. But that fuel has a really great ability to release heat, and not just heat by combustion, but also heat through all the systems we use to cool our engine. And again, if you're in the upper latitudes, we're talking about also diesel heaters, things like that. Chemicals, we'll talk about chemical burns, but there are corrosives, there are acids, there are alkalis, and all of those things can create a burn, and that's going to be a problem. Pressurized systems, this is going to be your refrigerants, but also any sort of hydraulic system. These things create pressure, and pressure creates heat. And so ultimately, not only are we sort of worried about the pressurized fluid, but we also want to be concerned maybe about the actual heat created by that system. Friction, I think we're all doing our best to keep our sailing lines free of salt water, but after a good day out there, that's pretty much impossible. And our sailing lines and really any sort of moving fabric or textured surface can create a good amount of friction and heat. And then obviously we've also got electricity on board, as well as other sources of heat, whether that be cooking or the like. So when we talk about thermal burns, I guess this is what everybody thinks about. And so when we talk about thermal burns, they're caused by heat most of the time, but again, that extreme temperature could be cold. We categorize them by how they were caused, how deep they are, or we grade them, I could say, by how deep they are. I think there's three things to talk about in the photos that are up here. This is a galley fire on a 30-ish footer. And what you'll notice is that the fire's going up and the fire extinguisher is pushing that fire against the wall. And so again, with fire extinguisher games, remember you pull the pin, you aim, you squeeze, and then you sweep at the base of the fire. That's the sort of rigmarole here. But you also want to be cognizant, like this would be a perfect fire to use a fire blanket on. Because if you put that blanket over the fire, it's going to contain the fire downward and not push it in any other directions. The photo in the top right is of an electrical fire from a 220 outlet. And I think what a lot of people don't realize is that in electrical fires, any part of the wire can light on fire. And in a boat, that can be a huge problem because most of our wires are not visible. They're running through, conduits and underneath things. The picture in the bottom right is actually of that container ship or ro-ro that lit on fire a couple months back. And it was full of electric cars. And so I think that the lithium change that we're seeing in sailing yachts is fantastic. I think that lithium chemistries are getting safer. Their energy density is excellent. I do think it's worth considering where you're getting your battery and whether we're being whether or not there's a battery management system on board, because those lithium batteries can create a very different type of fire. As a fireman, we're working through how to deal with electric cars because some of the techniques we use on internal combustion cars are not safe in the electric car world. And obviously, we're not talking about cars, but that middle picture on the right is a lithium battery that ran away. And that's actually what can happen to these things. So again, good electrical hygiene and battery management is going to be key in anybody's vessel that's got lithium on board. It's great for everything. It just is a additional consideration. And again, I don't want you to look at boat fires too much, but I do think it's worth remembering that everything on board this boat is potentially flammable, and so it doesn't take long for a fire to get out of control, and that's why having a plan, having accessible fire extinguishing materials is going to be key, and also understanding the flow of air and what we can do to decrease the movement of fire. Again, when we think about hatches and portholes, ultimately, if there's a fire in the galley, one of the things we want to do is stop the air movement so that we can fight the fire where it is and we don't have to find the fire and where it went. So let's talk about sunburn. I think this is something that I see happen to the pros and the naive, but ultimately sunburn is a great way to ruin your day. It's technically a radiation burn, actually, and it typically is going to be superficial, but you can get sunburn to the point where you get a couple pretty unique problems. So if everybody has had a sunburn, on the left in the top, you see a first-degree burn. On the right in the top, you see a second-degree burn. That person got enough of a burn there that you can actually see that blistering happening. And anytime you see blistering, that's a second-degree burn. I think it's worth noting that different skin tones get sunburned differently. So I'm like half ginger and I turn red every time I'm outside, or my freckles connect, one of the two. But just because you have a darker skin tone doesn't mean you can't get sunburn. It's just going to present somewhat differently, but you're going to have a lot of the same symptoms. I think my favorite sunburn of all time was I drove from Boston to South Carolina. And I did it in a day, and I had my arm out the window the whole day. And when I got down to South Carolina, my left arm and the left side of my face was horribly sunburned, and the rest of me wasn't. And I just didn't think about the fact that I was getting all this sun only on one side of my body. So just be cognizant that the sun is everywhere, especially when you're on the water, and that sunburn is a really unfortunate way to ruin some time. The other piece of this is that really bad sunburn or really diffuse sunburn that covers a lot of the body, can actually give you some pretty serious problems. Like it can make you systemically dehydrated. You can end up with fevers and chills, fatigue, headache, nausea, all sorts of things that you don't want to have while you're on the water. So again, a nice, clean, dry sun shirt is a great way to get away with having to put sunscreen everywhere. And again, like a wide brimmed hat, some chapstick, these are all some things I think are sort of going to be key here. We'll talk about this picture in the bottom right here in a minute, but I think it's worth noting that again, sun poisoning and sunburn are a real thing. this is one form of sun poisoning, and it's called PLE, or polymorphous light eruption, and it's effectively a sun rash. Um, Basically, what happens typically is that if you have like a New Englander, or you have someone from the Pacific Northwest or the Midwest, and they go down to the Caribbean, the UV index is sky high, and they've been wearing long sleeves and not been out in the sun a lot. And you can see this rash develop, a couple hours after sun exposure. It can happen to anybody, but again, the more naive you are to UV rays, the more likely this is to happen. And if it's happened to you once, it's more likely to happen to you again. You'll see sort of dense clumpings of these raised bumps. You can actually see them anywhere that the sun was, but typically they're going to be on the arms, legs, and chest. Um, on a good day, this lasts 2 to 3 days. On a bad day, this can last 2 to 3 weeks. And obviously, continued exposure to the sun is only going to prolong this. It's not dangerous by itself, but remember that the sunburn that you got while you encountered this could make you nauseous and dehydrated, and staying hydrated is going to be a key to managing all burns. Another part here, this is called solar urticaria. This is truly just hives caused by the sun. Again, this is more common in folks with naivete to UV indexes, but it can happen to anybody. People sometimes call this a sun allergy. But again, this can be really uncomfortable. They can be hot, they can be raised, they can be really itchy. The difference really here is nominal. But again, if you've had it once, you're more than likely to have it again. And so this is why if you ever see me on the water, I'm going to be wearing a long sleeve shirt with a hood up, because that's the best way for me to avoid getting any of these sun-related problems. So let's talk about burns. Just a quick disclaimer, I didn't pick the goriest pictures that I had, but there are some pictures of people with burns. The reason is I think that these cartoons are great for talking through what these look like and how they're formed. But I think that it's worth evaluating what they actually look like on a human as well. So superficial first-degree burns, everyone has probably had one of these. They're typically caused by, I grabbed a hot pan, I bumped into the oven rack with my wrist, the boat took a wave and the gimbal was off, and here we are. You're burning through the outer sort of dead layer of skin and just into that, not past it. So the good news here is that this isn't a problem by itself. If you get a first-degree burn all over your whole body, you're going to be miserable and dehydrated, but you're probably going to be okay. When we talk about first-degree burns, the real issue here is if you burn enough of your skin, you start to have trouble regulating your temperature. And so this is why people can have like fevers and chills at night where their body temperature is just going up and down like crazy. Remember, anytime that you damage your skin in any way, you're now at an increased risk for infection. We'll talk about infections in a minute, but just understanding that any damage to your skin increases the chance of your skin performing poorly and becoming infected is important. And when I say performing poorly, I mean it's not as good at feeling the things around it because it feels numb. It might be less good at keeping the moisture in your body. And again, it's definitely more prone to further burning. So you can't just like bake on that first sunburn and say like, oh, we're good. I got my burn on day one. I'll be good on day two. You can definitely stack a sunburn. Again, the goal here should be to avoid this with some degree of sunscreen. I don't work for a sunscreen company, but in my opinion, you should be using Reef Safe sunscreen. It's a little bit more expensive. Pro tip on the cheap side, all children's sunscreen right now seems to be more Reef Safe than adult stuff, and it's cheaper than buying the mineral sunscreen that you see out there. I've been trying to avoid the avobenzones and all the chemicals and sticking with the elemental or mineral sunscreens. They're harder to rub in, but they're safer for the environment, and they typically do a better job of blocking that full spectrum of UVA and UVB light. Second degree or partial thickness burns. So this is denoted by blistering. It's worth noting that every second degree burn is surrounded by a first degree burn, right? So typically you don't have an isolated second degree burn with nothing around it that was burned a little bit less. And that's just sort of the way that heat dissipates through tissue. I think when we talk about second degree burns, everyone's going to want to pop the blister. Just understand that there's two parts of this blister we need to be cognizant of. One, everything in the blister came from your body, and therefore it's sterile to you. It's also a sign of how much liquid you lost to this burn, right? You're going to continue to lose more, but all of that blister is just lost water. So even if you burn your arm a little bit on the oven, being well hydrated is going to help you heal better and feel better quicker. If you can avoid popping the blisters, you should. Truth be told, that can be very difficult depending upon where the blisters are. But again, as soon as you pop that blister, you've now got a break in your skin, and that increases our likelihood of infection. So again, if you end up popping a blister, we just need to be more mindful of keeping that wound clean. And we'll talk about how we can do that here in a minute. Just another diagram of the skin. Remember that in partial thickness burns now, you're damaging sort of the muscles that make your hair stand up end and some more blood vessels. So there's notably more fluid loss in a second degree burn than in a first degree burn. In the top left corner of the screen is one of the medical tools we use to estimate what's called BSA, or burn surface area. This is important because the more body surface that is burned, the more dehydrated a person is, and the more aggressively we're going to try and get them rehydrated. In the hospital, this involves IVs. In the cruising world, this would mean giving somebody electrolyte-rich fluids. Because remember, when we lose water, our sweat tastes salty. So does all of this. We're losing electrolytes as we lose water. So for those of you that have an RO system on board, it's good because it gets you water out of the salt water, but we actually need to add some electrolytes back into that water to adequately hydrate ourselves. When we move on here to third degree burns or full thickness burns, this is where we've gone all the way through the skin. The skin is now dead. It's going to either grow back slowly, or we're going to need some sort of grafting to fix this. Third degree burns are all the way through the skin, but not necessarily all the way through the muscle and bone. For lack of a more grotesque statement, you can cook a person all the way through as well. So a third degree burn, you might have muscle functionality underneath still, but if you continue to allow that burning process to occur, you'll eventually get to a place where the muscle and the connective tissue and the bone is all dead. And that's when we start to look at needing to remove pieces of limbs and things like that. Third degree burns don't hurt because the nerves are dead. The nerves in your skin are gone. And so the scary part about a third degree burn is if you can't feel it, that's not good. And they cause people pain because just like a first degree burn was around a second degree burn, well, a second degree burn is going to be around a third degree burn. When we talk about electrical burns, we sort of ignore the first, second, third degree, and we'll talk about why that is when we get to electrical burns. But again, like any involvement of connective tissue or muscle, this is like an immediate surgical problem, and unfortunately something that we need to have professionally evaluated. The risk of infection is super high here because the skin has no integrity left, and we've already lost a good amount of liquid, okay? Okay, chemical burns. There's a lot of chemicals on board a boat that make cleaning and degreasing and doing all of this stuff easier, but just understand that all of those chemicals are dangerous. The most efficient way to carry them is concentrated because we can make water, but the more concentrated they are, the more dangerous they are. You'll hear me say this a few times, but dilution is the solution to pollution. We want to make that chemical the least potent. So we want to get rid of it as best we can. Any dry chemical we want to brush off before we add water in case the water could activate it. But ultimately speaking, we want to get these things off and dilute them with water and wash that body surface or orifice with water as best as possible. If you've got chemicals on board the boat, you need to know what they all are and which ones you can mix and can't mix. Don't need anybody making mustard gas by accident. I do think that it's also worth noting that chemicals in the eye can be extremely problematic, and we need to be able to wash that limb or that burned area or eye for like up to 20 minutes with fresh water. Be cognizant with dry chemicals and boat wind. Just understand that if you walk upstairs up the like from the galley, probably best to tell everybody to go forward so that you don't blow a bunch of the chemical dust into their face and eyes. That's something we've seen a few times. Okay, electrical burns. We're going to talk about electricity for a few minutes here because there's a lot of it on board and we're getting more and more of it onto our sailboats, but ultimately it's still super dangerous. What you see in the bottom left is a person who effectively was grounded in their foot. And so the electricity went in their body and came out their foot. And that's why you see that sort of black area there in the middle of the foot. The problem with electrical burns is that you don't necessarily know the pathway that the electricity took. We're going to talk about the body as a conductor, but just understand that dry skin is fantastic at resisting electricity. Wet skin is really good at conducting electricity. And most things on the boat are wet and covered with a little bit of salt. And those are two things that make conductivity a lot easier. Again, the skin is a good resistor, but the blood and blood vessels are effectively perfect wires. And so the goal needs to be to keep all sources of electricity out of the body so that we can try and keep the electricity in the wires. Remember that anytime someone's been electrically burned, before you approach them, you want to render that situation safe. And that's going to involve understanding where your disconnects are and understanding what load is on what circuit and what needs to be done to kill those loads. This is especially problematic when we start talking about shore power, because I don't know that I've ever been on a dock where I look at it and I think like, gosh, this was wired intuitively. When we talk about this picture in a little bit, this is what happens when you get struck by lightning. It turns out that a little bit of electricity can be dangerous, but all of the electricity, like getting struck by lightning, is rarely fatal if you actually get hit by lightning. And if you do, you actually end up with this figure on your body wherever you were struck, just like every other organic material, whether it be a tree or a grassy field. It's called a Lichtenberg figure. It's one of the coolest things I've ever seen. So if you ever see somebody with one of these on their body, they got struck by lightning, and you should congratulate them and then probably not stand near them. This is a very loud slide that I don't want to go into much detail on, but just understand that low frequency alternating current, what we have on board our boats, is super dangerous because it can make you squeeze onto something and not be able to let go. If you ever see somebody holding onto something and they can't let go, don't touch them. This is the one time it's okay to throw things at your friends. Direct current is dangerous, but again, your skin is a pretty good resistor, and when you're dry or wearing gloves, ultimately we can stay away from DC electricity pretty well. If you get hit with a DC shock, it's going to be more potent, but short lasting. And ultimately, when we talk about damage to the body, there's going to be a couple variables in here, and one of them is going to be duration of attachment or duration of electrocution. Please understand that 12 volts at 200 amps is just, a 200 amp hour 12 volt battery is more than enough to cause a problem. But your skin is good enough at resisting this that you could actually touch the terminals and probably be fine. Don't do that. This is another math problem for people. This is just actually how this works and how the body functions as a resistor. So down at the bottom is what people would feel from X amount of milliamps. Do understand that 2000 milliamps is 2 amps. So, 1 amp is enough to kill a person. And we've got a lot of things around the boat that are putting out significantly more than that. Okay, so burn management. 100% of the process here is going to be stop the burn from continuing, remove the heat from the person as best as possible. So cool water can be super helpful. If you don't have an endless supply of cool water, you can pour cold water into something absorbent and use that. Okay. Again, I think a cloth covered in water is going to be helpful. You don't want it to be ice cold, but again, cool water, because the goal isn't to make them cold, it's to get the heat out of the tissue, okay? We want to clean the burn area and the area around it as well. We don't want any of the skin bacteria that's naturally living on us to be able to get to that damaged skin after the fact. So we want to clean the area with some sort of antiseptic if possible. We're going to talk about burn dressings and what we can do. But if you have a really bad burn and it's small, you typically don't need to go to the doctor. You just need to manage it appropriately so it doesn't become an infection, which we'll talk about here in a minute. So there's a lot of burn dressings on the market. And what I want everyone to understand about them is they do like 2 or 3 things. They function as a wet cloth, so they remove heat. They typically have like lidocaine or something in them that will stop the pain. And a lot of them also have some sort of antimicrobial properties to kill all the bad stuff on and around the burn. They can work really, really well. Do understand that they need to be changed, and do also understand that if you have too much burn and you put too many of these things on a person, you can actually take away too much heat. So they are good. I do recommend them. I wouldn't buy like the full body burn kit unless you can find it on sale, because some of this stuff can be really expensive. So burn gel, burn dressings, in my opinion, the dressings are better. They stay on, they don't smear as much, but there is gel-based burn ointments as well. Silvadene or sulfadiazine, depending upon brand versus non-brand, is also a really good antimicrobial that can be used to prevent burns from becoming infected. So I definitely think you need to have some way to manage a bad burn on board a vessel. And these are 2 really good options out there. Again, a key to management is going to be removing anything that's wrapped all the way around the body. All jewelry comes off everywhere, not just on the burn side. That's because when we swell, we don't want to get anything stuck. I'm a big proponent of no rings on a boat. If you want to wear a ring, wear a silicone one that we can cut. But ultimately, I make people take all the jewelry off of their hands when I'm sailing, because I don't want to deal with a strangulated finger. The down here in the center you'll see is a silver impregnated dressing. Again, much like Silvadene or silver sulfadiazine works, silver is naturally antimicrobial. And so these dressings just have impregnated silver threads that actually prevent the buildup of microbial growth. I think it's also worth noting that you guys are in a hot, humid, damp environment. And so diligent changing of dressings is going to be important, because the little things love to grow in the hot, humid, damp, dark environments. Pain control, burns are really painful. So NSAIDs or non-steroidal anti-inflammatories are great. Tylenol is great. This is one of the times where having controlled substances or some sort of stronger painkiller on board might be a good idea, but it's also a logistic nightmare to accomplish. All right, questions about the burns?
Okay, let me see what questions we had so far. One that we don't have to answer because you already did was, does cooling a burn surface help in any way? So I think you answered that. Can adults use children's sunscreen?
Yeah, they can. It's a little harder to rub in, but it's the same stuff.
It's harder to rub in if it's the kids' version?
No, just all mineral sunscreens are harder to rub in than the synthetic ones. But ultimately, you can put baby sunscreen on a 50-year-old and it'll work just as well.
Okay, and then the other question that was asked is, are there specific medications which make you more susceptible to sun poisoning?
Yeah. Though there are a number of antibiotics that make people extremely susceptible to sunburn. There's a bunch of them, to be honest. But the worst two are probably doxycycline, an antibiotic frequently used to treat skin issues as well as malaria in some places, and then Accutane, which is used for typically adolescent acne. Some of the other antibiotics too, but yeah, there definitely are medications that make you susceptible to sunburn, and then there are some like doxycycline where like maybe you should stay inside. Like it's a pretty severe change in your resistance to the sun. It's a great question. Thank you.
Okay, any other questions on skin before we move on? Okay,
All right, let's do it. So, what are we going to talk about? Let's get into the sea lice. So, sea lice are little jellyfish babies that are angry that you took them out of the ocean, effectively. They're jellyfish larvae and they're in the water. And so when they get trapped between clothing and skin, they get irritated. When you get out of the water and the water runs off and the larva stays behind, it can sting you. Um, Much like any other jellyfish sting, the worst thing you can do is spray it with fresh water. In the ideal world, you would be able to rinse it off with salt water. And that's because the nematocyst, the stinging cell inside these jellyfish, no matter how big or small they are, can actually be triggered by a change in salt content. So, like, the worst time that this happened to me, I got out at Scrub Island in the BVI. I went on a dive. It was a great dive. I hopped in the pool and I felt like someone just electrocuted me. And it's because I had some of these sea lice under my rash guard. And when I jumped in the pool, all of them fired at one time. And so I ended up with a bunch of these little red dots. They were pretty uncomfortable for a couple of days. Um, Again, it can happen like in the water, but typically it's going to be like 15 minutes after you get out when your skin starts to dry and up to like 4 hours later. I think like rules of thumb, you always should rinse yourself off with fresh water before you go to bed. You don't want to get these things into your bed, but salt water after you get out of the water. Um, Bad news for all of y'all that are on the rally cruise right now. It is the worst between March and August. Sorry, the season for this is between March and August, and the worst is in April and July. This is typically true in the Keys, the Bahamas, the Gulf of Mexico, the Caribbean, and the Atlantic. What can you do? You can take all of your clothes off as soon as you get out of the water, and you can rinse yourself off with salt water. What you'll see in these two pictures is that the people in these pictures are more marked up where they were covered. So the picture in the bottom left, this young lady had a necklace on, and that's why there's that sort of perfect circle around her neck. We see a lot of these sort of mimicking the shape of the clothing that you're wearing. So get out of the water, take off your stuff, rinse off with some salt water, put your clothes in some hot water if you got stung before you put them back on. If you had a massive outbreak of sea lice sort of stings, I would probably not wear that bathing suit for a little while. You certainly could wash it with a clothes washer, but again, hot water by itself will do it. You want to make sure though that you rinse with salt water and then fresh water. So get the organisms off and then get the salt water off. Don't start with that fresh water. Again, if these are really bad, hydrocortisone cream or calamine lotion can be helpful for the itchiness and the lack of comfort. Antihistamines can stop the itchiness if it's really profound. And then non-steroidals like ibuprofen are going to be really good to combat the inflammation. And if it gets really bad, we could go with PO steroids or by-mouth steroids like prednisone. But typically the topical steroids like hydrocortisone are going to be fine. Swimming in the buff is always recommended, except you still have to wash the larva off. Okay, so tinea. There are a bunch of tinnias, but they all have one thing in common, and that's that they're caused by ringworm. The good news is that ringworm is not serious. The bad news is it's super highly contagious, and it loves damp, hot, humid things. And that's like the whole Caribbean. If you get tinea on your scalp, it's called tinea capitis. If you get tinea on your feet, it's called tinea pedis. But all of them are caused by ringworm. Depending upon where in the body they are, they'll look a little bit different. So ringworm on the trunk of the body and the arms and the legs will typically give you this circular appearance that you see. Whereas when you see it in the groin, it's going to be spottier. Again, and then between the toes, it's going to be this sort of like layered peeliness that you see here. But again, this is jock itch, athlete's foot. It's all caused by the same thing. And the good news is it's all treated with like a topical antifungal. And so all of these things are available over the counter. I don't think that, I think every boat needs to have at least a tube or two of this on board. Because it can be really expensive and hard to find. But in most places in the United States, you could find 700 versions of this in the store. I will teach you a secret. It's all the same medicine. So if you see like Lotrimin, Lotrimin AF, Lotrimin this, Lotrimin that, get the one that's the biggest tube with the highest percentage of the active ingredient. It doesn't matter if you put it on your arm or your foot. It's the same medicine. So again, you do not need one for the foot and one for the groin. It's all the same stuff. Okay, abscesses. So think about a pimple. A pimple is a cutaneous abscess, but close to the skin, where you get sebum and sort of some oil buildup, and it clogs a hole. And below that, stuff can accumulate. In the ideal world, it's just more of your body's oils. And in the worst case scenario, it can actually be bacteria. And so an abscess happens. This says heroin abscess, but it doesn't matter. They're all exactly the same. You have an abscess. It's not connected to the blood vessels around it, and it's kind of walled off by your white blood cells. And as a result, antibiotics taken by mouth can't kill what's inside it very well. So instead, we've got to get the stuff out. So how do we do that? On a good day, you use a warm compress, you put it on the tissue, and you hope that it sort of works its way to the surface and it can ooze itself out. It's kind of gross, but that's the best case scenario. The other option is that we've got to drain it. So anytime that we see fever or streaking, or it's on like the face or genitals, we want to be a little bit more concerned because those tissues are very sensitive. The idea would be that we would actually cut a hole, get all the stuff out, and then prevent anything from going back in there. I'm not going to recommend that you do this by watching a YouTube video, but I will say that we've definitely had to walk people through doing this on a boat. And it's not a difficult procedure, but anytime that you're taking a scalpel to a person, it's best that you're being guided by a medical professional. You'll see in this top right picture that somebody outlined it in marker. I think Sharpies are maybe the most important medical tool when it comes to treating skin problems. And that's because we're really good at noticing when things look bad, but we're not great at determining when they've changed unless it's massive and obvious. So one of the things anytime you're concerned about a skin issue on a person you want to do is outline it and put a time there. Because if in 2 hours it's bigger, you'll have a graphic representation of how much bigger it got, or if it's tracking in a certain direction. And those are all going to be helpful things to us to understand how quickly it's going and what we need to do to try and fix it. So if you have an abscess, it's a pocket of infection under the skin. Cellulitis is just an infection of the skin. Good news, cellulitis is very treatable, but it can go quickly. So this is, again, one of the reasons why we say that having antibiotics on board is super important if you're going to be anywhere more than like a day or two away from C, because the cellulitis can go from bad to very bad in less than a day. It's a bacterial infection of the skin, typically causes redness and swelling, some heat and pain. The biggest concern here is if it's fast moving, streaking in a direction, or causing fevers and chills. A lot of times it's caused by a break in the skin and the natural bacteria of the skin getting underneath through that cut. But it can sometimes be caused by MRSA, or methicillin-resistant Staphylococcus aureus, one of the bad bacteria out there that's gotten good at fighting antibiotics. As a result, you'll find a lot of folks carrying multiple antibiotics on a boat, and one of them will be specifically designed to deal with MRSA, and one of them will be designed to deal with all of the other stuff. So again, when we start treating skin infections, because they can get out of hand so quickly, your skin's the largest organ in the body. And so what we want to do is stop it quickly. We might tell you to take 2 antibiotics because we aren't entirely sure what caused the infection. So taking both of those antibiotics is going to make sure that we contain that bacterial organism. You can see down here, bottom left picture, they've got an outline followed by an outer outline. And so again, that's indicative that this wound is actually getting better or worse. And so they're either tracking it in or out. Both are going to help, especially if you're sending pictures to somebody or trying to see how things got better or worse. Okay, some of the creepy critters. So larval migrans are little worms that can be in the feces of animals, wild and domestic, and basically they poop on the ground and then step in their poop, or you step in their poop, but the worms get spread out on the ground and then they can get into our body when we touch the ground. I think walking around barefoot is one of my favorite parts about the Caribbean, but it would be remiss to not mention that if at any point you see these little streaky worm-shaped looking things, you might have worms. Now, the good news here is it's the most common in your feet and hands. The bad news is it could be anywhere. The way we treat this is with a deworming medication like an albendazole, a mebendazole, or an ivermectin. They're very manageable, but they can be itchy and uncomfortable and unsightly. There's no way to get rid of them other than those medicines. So again, you can wear shoes and not worry about it, or you can carry one of these somewhat inexpensive medicines just in case somebody ends up with the worms. Okay. I didn't put a video up here of this because it's gross. But lots of different fly larvae can get under your skin. And if they do, they create what looks like a big old pimple. And then they can like move. And it can freak people out and be really gross. They are common in Central America, some of the Caribbean, and most of South America and sub-Saharan Africa. theoretically it could happen anywhere that there's a fly larva, but basically they go through an existing hole in the skin, whether it be a wound or a mosquito bite. And then they grow under your skin and they get to a place where the hole that they went in is too small for them to get out. And so they eventually have to break part of your skin to get out. And they do that by weakening the skin. We get these things out by pulling them out with tweezers. This is by no means something you need to go to a hospital for, but someone's going to be grossed out. You can sometimes get them out by suffocating them. And like a thick oil, I would use a food grade oil, not a motor oil, or Vaseline or bacitracin or Neosporin. Something that prevents air from getting to them will sometimes make them come out, and then you can grab them and get them out the rest of the way. So again, if you've got stuff moving under your skin and what looks like a pimple, you could have one of these. The good news is as soon as they're out, the pain is gone. The bad news is that as they grow and stretch your tissue, they can be really uncomfortable. Okay, sand flea, same idea here. We've got a little larva on the ground and they can bite you and leave some eggs. And as a result, you can end up with those things growing and creating a problem. How do we get rid of these things? Same thing. We can suffocate them out or we can kill them with PO, with medicines by mouth. Again, these are relatively common in Central and South America. You do see them on some of the Caribbean islands. They're not, again, typically a huge problem, but they aren't comfortable and they can freak people out. Again, there's a million names for this all over the countries that are afflicted. So if you see the locals walking around and their feet have a lot of little like red and black dots all over them, that's a good indication that you should probably wear shoes. Okay, so what can we do? This, for those of you that have been to the first talk, this is the same slide. And I didn't change it because I think, you know, there are certain risk factors associated with sunburn and with skin diseases. So anybody who's got poor circulation, is taking blood thinners, has diabetes, we want to be more concerned about our skin because we've already got a skin issue. Having medical information about our people to include their ability to take antibiotics. You know, a lot of people think that they're allergic to something, and then you ask them why, and they say, oh, my mother was, or I just heard I was. So understand what people's allergies are to medicines, understand what happens when they have that allergen so that we can stay away from giving anybody medicines that could make them worse. Antibiotics are cheap. I 10 out of 10 recommend finding a solution for getting antibiotics on board any boat that's going to be more than a day away. Again, these things can mean the difference between continuing a vacation and aborting a crossing, and it's real simple and inexpensive to have a couple of these things on board. Again, I think learning like we're doing today is a core thing to making sure we can be safe out on the water. So, you know, having a good exposure to what these things look like and how to manage them can be key. I think that's it. So if people have questions, I'm certainly willing to stick around and answer anything that I can, but I appreciate you all.
Well, Alex, thank you very much. You totally grossed me out.
I was worried I might do that.
But that's okay. That's okay. And we will go get our fair share of antibiotics as well. Let's see. And yeah, somebody else, their comment was exactly the same thing. Are there any other questions from anyone? The antibiotics you listed tonight on the various slides, is that kind of the what we need from a skin perspective, or are there others?
So I think a Bactrim or its
Whoops.
generic and a Clinda are probably good. Doxycycline is really a great antibiotic. but it makes you really sun sensitive. So if you have a person who can't take one of the other ones because of an allergy, then Doxy is a great antibiotic to have on board. But as a person with fair skin, I would avoid taking doxycycline on a boat as best as possible because I just worry about the sun exposure that's never going to go away. I think having a broad spectrum like a Levaquin or a Cipro is going to be a good antibiotic for generalized internal pieces. Having some specific ear and eye antibiotics is going to be helpful, and then having some specific skin coverage. And again, if you have any allergies to antibiotics or sensitivities, then picking the appropriate drug that doesn't give you the problem but has the same coverage is going to be very helpful.
Yes.
Jeff, I have had this problem many a times, and that is that you can buy a lot of things over the counter in a lot of countries. And it turns out like on some of my international deployments for disaster work, we had like Russian and Chinese meds, and I can't read either of those languages. And so Google Translate, you can actually take a picture and it'll tell you what it is. And so if you have the bandwidth, that was the hope. Was to try and solve for X or put a sticker over it. But a lot of the foreign meds can be got for real cheap and without a prescription. And I think having the tools in your toolbox is the most important.
There was a question about best skin cream for itches.
So I've had really good. So there's sort of like two modalities here, right? One is a skin cream with nothing in it but moisture, and another is like a Gold Bond or a medicated skin cream. And it's sort of people end up on both sides of the fence. I think anytime you're going to put skin cream on, it's worth making sure you're putting it on clean skin. And then also that we're cognizant of what we then go do. A lot of people put skin cream on and then go lay down and they just wub all the cream off. And in reality, you want to let most of that stuff absorb until we're not sort of tacky or wet.
Okay, there was another question about having available history of crew. We have a form that we will publish that Alex helped us develop that I think will answer that question. And then another question is, what is the cream antibiotic people use after being cut on a reef?
What is the cream?
So I guess if you get a reef abrasion, is there anything in specific for that?
So I would imagine that we're talking about just like so silver sulfidine would work. Any sort of antiseptic, so like a bacitracin, polysporin, neosporin, all of those would work. I haven't heard of a specific agent that's better for that. You could use some iodine, but just understand that iodine prevents healing. So I think you want to do your best about keeping it cleaned and then getting some decent antimicrobial cream on there. But yeah, I don't have a specific one for reef stuff. I could take a look and see if there's anything in the literature, but in my experience, bacitracin, this generic multi antibiotic ointments work pretty well.
Okay, and then Fred Rampy had a question. If you're exposed to I'm not sure how to pronounce it, the manchineel tree, the stuff that comes off of those trees.
Yeah. Um, gosh. So unfortunately, like this is a chemical burn, and really like from there, what you certainly can't eat it, that can kill you. If it gets on your skin, it's pretty uncomfortable. Gosh, I think washing it off is going to be your best bet. I think a lot of times people touch the trees, but again, it's an oil that you need to get off of your skin. So soap would probably be an ideal start. Um, gosh, uh, yeah, I think if you have the powder on you, you don't want to make it wet, right? That's one of those scrape it off. And like it basically produces a contact dermatitis. And so from there, once it goes away, you're treating the symptoms, not the exposure. Um, I think the scariest stuff that I've seen with Manchineel is people burning it on the beach, and then you've got like a really dangerous caustic smoke out there.
Wow.
But again, I think for the most part, you want to stay away from putting any other things on it other than trying to sort of wash it off, um, and hope to avoid it. You see a lot of islands down in the Caribbean now, um, actually marking all of them with like poisonous tree or manchineel tree. Um, Again, like calamine lotion, antihistamines, just like any other dermatitis could be helpful. But first, I would make sure you get all that stuff off.
Okay. And then we had another question. How do we decide when any of these maladies reach the point where care beyond the boat underway is necessary? As in,
Yeah. Gosh. So second degree burns on like less than 2 or 3% of your body, probably totally fine. Over 5% of your body, you get a little bit scared for an infection there because it's hard to keep that much skin clean. Um, any third degree burn, definitely that's a get out now problem, because we want to make sure that that affected tissue can try and stay alive. Beyond the burns, if you don't have antibiotics on board, cellulitis that grows, um, more than double in size is a big concern because nothing's going to slow it down but antibiotics. And so, again, with the infections, anytime something is streaking or moving or growing, we really need to be able to try and kill those things quickly because they can quickly become a systemic problem. And so, for me, you know, uh, the parasites, that's probably not a get out now problem. It's uncomfortable, but it's not going to get precipitously worse because it's not self-replicating. Whereas a bacteria can grow in you without you doing anything. And so we want to stop any sort of tracking or streaking of a bacterial infection, growing of an abscess or a cellulitis or a high degree burn, like a large surface area second degree or a third degree burn. Electrical injury, I'm gonna regret saying this, but if you're okay after it happens, you're probably not going to die from it. The biggest concern is that if I get shocked on my two hands, that my heart is in the middle. So the hope is to get through the initial electrocution, but then the tissue can be very badly burned along the whole route. So with bad chemical burns, if you can't completely stop the burning process, we're going to want to go to the hospital. And if you have an electrical burn, um, that's between left and right sides of your body, or both feet, you want to probably seek medical attention because there's no telling how much tissue was involved.
okay. Um, Janet had a quick tip. She was suggesting another way of coming with a warm compress. is
Yep.
using a semi-cooked potato.
Yeah. Yeah. So it's
Okay.
again, like wilderness
And
medicine 101, you can boil a potato so that it's sterile and then use the potato skin as a warm compress or also as a bandage.
for those of us that don't have necessarily all the antibiotics we should, and we're down here, any suggestions on the easiest way to get them?
So there's sort of like two opportunities here. One is you guys have another sponsored organization for Salty Dogs that builds kits for people doing stuff like cruising. And I don't work with them or for them. I'm just they're another one of your sponsors, and they do pretty good kit build out, and it's a service. So you call them, you tell them what you need, they call you, they write you a prescription, they mail you the things. They're called Duration Health, and
Right.
they are one of the services out there that provide that sort of a concierge service. You can certainly also go to your doctor and say, hey, I'm going to go cruising for a year and I'd like to have some antibiotics on hand. I think some doctors are comfortable with that, some doctors are not. Folks that subscribe to our service, one of the things we do is we're happy to write a letter to your doctor that says we're going to be there on demand medical direction. So if that is going to make your doctor more comfortable and more willing to write those prescriptions, we can certainly say that you're a client of ours and that you're going to be using those antibiotics under the direction of a doctor. And a lot of times that makes docs more comfortable. You could find the doctor that lives in your neighborhood and ask for a favor, or go to a pharmacy in a country where the laws are laxer than the United States. Those are sort of the like four modalities for doing this. Pay a service, ask your doctor, ask a doctor, or find a place where you can buy things over the counter.
Okay. Any other questions? Going once, going twice? Well, Alex, again, another great talk. Thank you very much.
Thank
I
you,
think we're
guys.
all continuing to learn a lot. Tonight was definitely creepy.
Sorry.
That's okay. It will make us think. Okay, thank you very much, folks, and we'll see you at the next webinar.